disease is for old people. Not true. Your cholesterol is normal, so you can't have heart disease. Not true. If I'm exercising, I'm healthy, and it doesn't matter what I eat. Not true. When we look at how long is this person going to live, it's fairly simple. How strong is the heart pump?
What is blood pressure and why does it matter in terms of cardiovascular health?
Think about it as the amount of resistance that the heart is seeing with HB. Increased workload over time is dangerous because at some point, the heart is going to start to fail.
Dr. Jeremy London, welcome. So happy to have you here. As you know very well at Whoop, we are all about providing our members with the tools and insights they need to take control of the trajectory of their health. And what I see you do on Instagram is literally just helping folks do that. You know, understanding how to not end up on your operating table seems to be kind of the MO behind your messaging. And so I think in that regard, our mission is really synergistic. And just want to say thank you for all of the good work you do, the advice that you're putting out there to folks. You have a massive following on IG for a reason, is because you're giving really good advice. So just wanted to, from the start, just thank you for the work that you're doing in this world.
Well, thank you. And I am absolutely honored to be here. And to have that type of accolade come from you really means more than you realize. So I really, really appreciate that. And, you know, it's interesting because for years, obviously, I can only take care of one patient at a time. You know, I'm in the office, I'm taking care of one patient. I'm in the operating room, I'm taking one. I'm not in a scalable scenario. I mean, I can hire more people and what have you, but in the end, my goal is to take care of as many people as I can. And so the social platforms, this was unintended, really, have allowed me to scale what I've been doing for 25 years. And it's like a 2.0 version for me as far as next steps in my career, because it's given me the opportunity to do exactly that, to try to share really meaningful information with so many people. And we get so much feedback, you know, simple things like, I didn't realize that I was having cardiac pain and I went to my cardiologist and I got 2 stents. Thank you for making that post. I got a second golden ring. And so it's really been a meteoric experience for me in a very short period of time. And it's been really, really positive. It really has.
Well, you're saving lives and transforming lives, you know, extending lives. And I think all of that is so noble. So thank you. So I want to start by asking you a question, and it's a true or false question, perhaps. 80% of cardiovascular disease is preventable.
I'd have to go false at 80% because I think that there are a significant number of people that have such a strong genetic predisposition that you can't run from your genes. Now, that being said, when you say preventable, modified, I think would be maybe a better way to look at it when we talk about, you know, we have this genetic predisposition, but what pressure do we put on those genes to express in a given way, that epigenetic kind of mindset? When you look at cardiovascular diseases in general, you know, I think that's really how we approach it, not necessarily that it's entirely preventable in those folks, but if you can modify it or change the slope of that curve, you affect people's lives dramatically, because that's health span and lifespan right from the get-go.
So when we're talking about genetics, is it heart size? Is it, you know, just your predisposition to build up plaque? Like, you know, what exactly is just
There's kind of 2 major categories. I mean, you kind of have the really hard genetics like familial hypercholesterolemia, where people are just born with this predilection to have really, really abnormal cholesterol levels. And there's several others that are very, very specific genetic abnormalities. But most of the genetic profiles, if you will, are multifactorial. It's not just one thing that pushes them down that road. Obviously, though the first category is fairly easy, those people are on medications very early. Those are not the people that you're, you know, putting on an elimination diet and increasing their exercise. You're doing all that as well, but they require, you know, kind of all knobs to the right to modify their risk factors before they get into trouble. But the ones that are multifactorial are the majority of us. And it's a matter of kind of figuring out, what your instruction manual is to help navigate that and to deal with those uncertain headwinds. And each of us are very, very different.
When a patient comes into you and you've never seen them before, and they might be wanting to just get a handle on their overall heart health, where do you start?
Well, you have to realize where I am as a cardiac surgeon. I'm more of the in-game guy.
Okay, so you're not on the front end of that discussion where you're getting people who have already been diagnosed.
Now, when I get that question, it's usually from a family member that's in my office. So we do have those conversations, but most of my conversations are more of the in-game type of conversations, like where do we go from here, and how do I now take this second golden ring and run with it in a meaningful way. But I think to answer your question, I think that we start simple. You start really simple for folks, because what's the hardest part? It's starting for all of us, whether it's an exercise program, nutritional plan, mindfulness. I mean, we can go down the list. And the reason is people are scared. They're scared of failure. And if you don't start, you can't fail. And I think that I try to have very general conversations before we even hone in on which of the pillars, if you will, we're going to focus on, that success in general it's not a straight line. And to understand that, life is going to take you in this kind of route as you continue this journey. It's not how you can continue to grind all the time. It's how you can figure out how you get out of those slumps so that you can pick yourself up by your bootstraps and continue down that road. So I think everybody is a little different as far as where you start, because there's some people that have their nutrition really dialed, but they don't move every day. There's some people that have their nutrition and their movement dialed, and they're horrible sleepers. That's me. Again, we each have our own instruction manual, and you have to really personalize those first steps. But if you picked one thing, what would it be? If you're a smoker, the smoking has got to go, obviously.
When you think about protecting your own heart, what's an overview of the behaviors that are kind of your non-negotiables or what you're focused on?
So for me, it has been nutrition and fitness. And that's been a real part of my life for a long time. And those things come pretty easy to me because I can control them. I can push myself to work out. I can control what I put in my mouth. And really what I have struggled with—
falling asleep and staying asleep.
I can fall asleep. I can't stay asleep. And a lot of that's from 25 years of being on call. And my sympathetic nervous system is like on DEFCON 5 all the time. And what I found was I was one of those I'll sleep when I'm dead kind of guys. That's how my mindset has gotten me to where I am. And that was really foolish because, I've got a stent in my right coronary that I had 3 years ago, and I don't really have any risk factors. But when we look back at it, this has been my risk factor probably all along. The reason that, again, I was scared and fearful because I couldn't control it. The harder I worked to control my sleep, the worse it got. And so
increasing the anxiety around it.
Absolutely. And so I've really had to change my relationship with sleep and really change my mindset kind of bottom top. And it has been a real struggle for me just because my body is so ginned up from all these years. But again, I think that when we look at, how do you approach your day-to-day, like control the things you can control. Like I want to at least get those things in my corner and make sure that I've got those maximized. And I've definitely been through lots of different nutritional waves in my life.
Dietary strategies.
Exactly. Yes. I mean, even back in the 90s when it was all no fat, you're eating pasta and no fat yogurt we all went through it. But, I think really once I got exposed to functional medicine in probably about 10 years into practice, I had a huge pivot in my mindset, both for me personally and for the way that I took care of patients.
Was that due to the exposure to your blood biomarkers and really being able to see what actually is happening?
This was well before the biomarkers were even in vogue. What happened was it was that taking care of the end game for 10 years. I really felt like I was fighting an exercise in futility, essentially, on a day-to-day basis. Fix me, doc, and we accept all this risk. You send them out and they go back to doing the exact same things that they were doing before. And it just felt like Sisyphus pushing the rock, up the mountain. And I realized we're doing something wrong. And that's where my mindset really shifted. Again, I kind of tried it on myself, and my wife got very engaged as well. And we're like, this is awesome, like clean up your diet and things get so much better. And it was really transformative. So I thought that I could actually integrate that into my practice.
It's easier than it sounds, right?
Well, it requires a lot of moving parts because the level of patient engagement is tough.
Getting humans to do things is hard.
That whole concept of we know better, we just don't always do better. That cognitive dissonance.
And I think you've pulled on a really important thread about changing your relationship to that thing. I feel like that is just such a fundamental aspect of behavior change that's often overlooked, or people don't necessarily take the time to think about their current relationship and think about how that needs to change. But I think that's at the foundation of being able to kind of create almost a new identity around that thing. All right, I'm going to become a person who eats healthy food. It's just like you kind of have to change your relationship to that and then change the way you interact with that change,
There's no question, because again, once you kind of get through that starting point, you have to have those day-to-day motivations that make sense and feel right to you.
Right.
And that's kind of the middle phase. And then after that, you have to have the validation.
Right.
Whatever that is, whether it's I feel better, the number on the scale is different, I look better, I'm following my biomarkers, I'm following my HRV,
right.
Whatever those things are for you, we all need that validation at various points to know that we're making progress, to again kind of reinforce that change in perspective. And that's what I've needed for sleep. Number one, that I feel so much better, as I'm moving that needle. And I've seen it in patients too.
Yeah. And you probably are seeing that in your HRV data, right? You're having more autonomic balance, or?
Yeah.
Okay.
Yeah. So
how long have you been working on your sleep?
About 3 months now.
Oh, you're kind of a newbie.
Yeah.
Wow.
I am. That's why I feel like this is a very cathartic process for me to have this conversation with someone who's such an expert. I feel like the HRV, I heard Todd Anderson make a comment on one of his podcasts that he felt like breath was kind of the steering wheel for the autonomic nervous system, which I think is a really cool way to look at it. What I have found personally is I find it a little more like a sailboat, where you kind of turn the rudder and kind of get into the wind. It's not as one-to-one as a steering wheel is. And yes, I'm seeing the kind of the fluctuations and the differences, but I'm feeling the difference as well. And I think that's really where I've really focused my energy and understand that that's going to be the foundation to getting my sleep back on.
Mm-hmm. I think that's a beautiful analogy. And there's no question that, when we are accumulating stress throughout the day and not managing it proactively, that will rear its head in our sleep. I do a lot of research with shift workers, frontline healthcare clinicians, acute care surgeons. We did a really big study, 27 different hospitals all over the country, and it was 270 acute care surgeons. And it was really interesting, sobering to look at their data in that, the mean age of that group, pretty even gender split, was 43 years old. Their resting physiology looks like 60-year-olds. 17-year difference, right? So, and what we see is just HRV that is in, again, they look like a 60, 70-year-old, human, right? So we know the toll of your profession is massive, right? So it becomes even more critical that you're thinking about these other levers to be able to control and manage stress. A lot of that management needs to take place during the day, in between your surgeries, presuming you do more, maybe sometimes more than one a day, and just all the other lifestyle things that you're managing. But I think the connection between your breath and controlling your autonomic nervous system throughout the day and its relationship to your sleep at night is a really important one. And I'm glad that you've kind of surfaced that for yourself.
Well, I think it circles back to your original question of like, okay, if somebody comes in and says, where do I start? And I said, well, it's different for everybody. I mean, sleep is so foundational and it impacts really every system in your body. The list of disease processes is unending that are impacted. That's the idea when we're talking to patients. First, you have to listen to them. If you listen to people, they'll tell you where they're struggling. They'll tell you what's wrong. And I think that's where you start.
Do you see the sleep profile in, patients who come to you? Or is it, do you have a sense of kind of what that looks like on average for people?
So a lot of my patients, because most of them have either borderline or full-on metabolic syndrome, have some degree, if not documented sleep apnea. And so again, I'm in that kind of in-game arena when it comes to these kinds of patients. I would say 25 to 30% of the patients I operate on are actively utilizing CPAP at home, and we require it in the hospital. And I think that connection with cardiovascular disease is undeniable for sure.
And I love the idea of kind of focusing on breath as a place to start. Learning how to breathe properly is relatively low barrier to entry. I think when you consider other, modalities that people can engage in, or other, or trying to take on a new dietary strategy, or, all of a sudden ramping up exercise, getting the breath under control is a place to start. Just literally, can someone breathe through their nose, for extended periods of time and not have to open their mouth? I mean, that is a really easy test, right? To see if people are capable of breathing properly. But I think that's kind of a under leveraged, potentially, kind of lifestyle change.
I don't even think it's included in many of the contemporary pillars.
Isn't that wild?
Yeah, it is. I mean, obviously, I think some of the real kind of tip of spear folks that we're all familiar with are dialed in to how important this is. But I think, things like sleep or even oral hygiene and the impact that it has on our cardiovascular systems, that, they seem so simple and they seem like they should be things that are taken for granted, but that's the problem. They are taken for granted, or they're pushed into a lower priority because they're not the sexy things to be doing, like, running 100-mile races or whatever it is, but they are so important. And I'm living proof of that. As much as I feel like I know better, sometimes I also don't do better.
When you're focused on trying to make your sleep better, it just creates anxiety. And oftentimes you might be carrying so much sleep debt that you're exhausted and you fall asleep, but you can't stay asleep. And that is a product of a lot of the stress accumulation throughout the day. It's a product of your light behavior. It's kind of some of these other things that really impact our ability to fall asleep, but oftentimes to stay asleep. And when we consider cardiovascular health, it seems like, that's the thing to figure out, and understand, like, what do our daytime behaviors need to look like in order to kind of facilitate a healthy, restful sleep.
I think if we look at nutrition, clearly, I think a whole foods based type of diet, whether you're putting protein at center stage based on your goals or not, those are all very personalized kinds of things. But clearly, a good common sense whole food diet with a reasonable glycemic index and is important. Making sure that you're timing your meals not too close to when you're going to sleep and what have you, as far as, taking that energy from your autonomic nervous system towards your gut, as opposed to where it should be when you're asleep and what have you. And then the idea of sleep pressure, as far as your activity level during the day is so important. And I'm learning that. I've got plenty of plenty of sleep pressure, but I tweak that because I take a nap, because I have to, or whatever. And I do fall asleep very easily because I'm exhausted, but I don't stay asleep because I think I'm modulating that sleep pressure in a way that's not allowing me to stay asleep. So I think that activity level, both physical and mental, is really, really important, for people. And then the mindfulness and breath work piece, however you find that, just getting out and going for a walk. Or interestingly, my parents began meditating in the 70s. I was maybe 7 or 8 years old when I learned transcendental meditation.
Wow.
And so it's been kind of a part of my life off and on for a long time. So I'm very comfortable with it, but I underutilize it in this way. But that's something that I definitely talk to patients about for sure.
Yeah. And I think that's where the feedback from the data can be really helpful, is just looking, we've got the feature stress monitor, which I found really valuable for instances like that to understand, what impact does meditation versus mindfulness versus a walk in nature have on my autonomic nervous system. And stress monitor, of course, is kind of an algorithm that's taking in both resting heart rate and heart rate variability. So it's really this, I think, nice, robust view of just what's happening with your heart, 24/7, and I think that lens into the heart, I think is really powerful, and how and the nervous system, how we're responding and adapting to stress, I think is really powerful. But how much do you use like that type of biofeedback to kind of decide which modalities are working for you versus maybe not, or where you're getting the most bang for the buck?
Yeah, I am a data guy.
Yeah, I know you are.
And I have been involved even in the late 90s when heart rate training, anaerobic threshold, wattage on the bike, all of that. My friends used to call me Jeremy Neutron.
Oh my gosh.
Because I was such a geek about my data, but it enabled me to finish, some really long distance endurance, iron distance races and what have you, because I knew my anaerobic threshold. If I hit 147, I slowed down and I finished without injury and finished strong. So I saw the immediate success early on with this data. Now, I think that I do have to be careful getting too focused sometimes on my data. I have to take a little bit of a holiday at times with it. But I think that this validation is really important. It's really important for me. And in this day and age with, the instantaneous information that everybody has at their fingertips, with phones in their hands, there's an expectation that we're going to do something and we're going to know if it's working or not working fairly quickly. And that gives personally and many other people motivation to kind of continue down that road. I think that the stress monitoring is awesome. I mean, it is in line with what I am doing every single day. I mean, I can see, yes, I agree. That is what my stress is. Ooh, I didn't work that hard today. I see that, again, it's an accountability tool for me for sure. But the biggest one, as you mentioned earlier, has been the HRV, because I think that is really where the magic lies for someone like myself, who's kind of been on DEFCON 5 for so many years that I got to get from here to here soon.
Yeah. What I love about HRV is it kind of helps you understand if you might be adapting just to a lower level of functioning. If you're not responding and adapting to stress in a functional way, your HRV isn't gonna rebound, right? That source of insight, I think, can be really powerful for folks, to make change and to know when to kind of pull back. And I think for someone, for people who are really hard charging, like it can be hard, to take rest days. But I think the evidence is really clear that when you are really strategic about your rest, you have the ability to modify your HRV. You can increase your ability to respond and adapt to stress in a functional way. And that should be reflected in increases in heart rate variability over time. If you're thinking about your training and all the inputs that are going, into the body, are they working for you or not?
Yeah, recovery is as important, if not more important, than whatever the activity is that you think is going to move the needle.
Yeah.
And that certainly is something that I've had to come to grips with more is not always better. I've gotten myself into overtraining cycles many times over the years, where you just start to see this plateau in your progress. And, a friend would say, well, yeah, when was your last day off? Muscles have to recover to grow. Our brains need sleep to go through the appropriate recovery phase. That's where our deepest memory and ability to memorize comes from, when we're in deep sleep. Like, those are all recovery pathways, and having the ability to objectify those things is really good for a person like me. Because when I see my HRV where it is, and I'm embarrassed to even tell you what my baseline number is, it motivates me on a day-to-day basis. And that's what's nice about it too. Unlike resting heart rate, which is a great tool for kind of your basic fitness level, HRV is right now. Even though it takes time to change those things, it's where's your autonomic nervous system today?
Yeah.
And it's really tactical in that sense.
Yeah, that's so well said. I want to talk about sedentary behavior. We know that's an independent risk factor for cardiovascular disease. And I want to talk about too much exercise, if that's even a thing. I think from the sedentary behavior standpoint, like I think you can exercise, but be sedentary, right? So I can wake up, I can run for 5 miles, and then I can literally sit unbroken for 8 hours, which is the behavior of a lot of folks, right, in the world. And it's kind of the nature of being a knowledge worker. Like, we're sitting in front of the laptop. I mean, I have to really be conscious of breaking up my sedentary time. What do we know about sedentary behavior and its impact on our heart?
You are probably even more versed in the study that was done, was it in the 90s, that coined the term, the sitting disease, and the fact that it is as dangerous or potentially even more dangerous than smoking when we look at a risk factor, independent risk factor for cardiovascular disease. And I think that's so interesting. And I think the point that you elucidated, that you can in your mind feel like, I got my workout in.
Right.
Now I'm cool just to go and sit all day. That kind of all or nothing is not really how our bodies work. And I think a lot of it is related to maintaining really stable glucose levels through the day too. Because that was one of the other things that I was just astounded by, was we would eat dinner and take the dogs for a walk, and I would watch my glucose level drop by 10, 15, 20 points with a 10 or 15 minute walk. And I think that that's one of the pieces that's so important, to have that glucose stability during the day, as opposed to the spikes without additional control.
And that's one way to train our metabolic system, right?
Exactly.
And I think that's, the walk after dinner is probably one of the best hacks,
No question.
It's not even a hack, just one of the best behaviors that we can take on board to get better control of our cardiometabolic health.
Yeah. We talk about it as it's the brushing your teeth.
Yeah.
It should be just part of the bedtime routine. Like that's just added because it's good for you.
Yeah.
And it really is. And I think that data is really well established. I think that's why the standing desks and the treadmill desks have gotten so popular. And I'm kind of like you too. Like, when I get really focused on something, I have to remind myself.
Oh man. I mean, I can sit for, my kids are like, you have a focus problem. Like, I can sit for like 4 hours and just like, I have to be really careful.
I share that plague as well. As far as the over indulgence, I think that there is really good data that the extreme is also in question. When we look at the data in some of the elite marathon runners and some of these ultra marathoners, and most of that comes from, again, the heart is a muscle. And you get this, what we call left ventricular hypertrophy, or a thickening of the left ventricle.
And this is characteristic of endurance,
super ultra guys. And, do they get blockages in their heart arteries? No, not normally, but they have different problems. They can have heart rhythm problems. They can have obstructive type problems where the blood actually comes out of the heart from where the muscle has become overgrown. I call it a hypertrophic myopathy. there's a lot of different possibilities there. And again, I think it just leads to anything in the extreme, unless you are in that small percentage of individuals that clearly function there, tolerate it, live for it, and they're just made to function in that space, that for the average human being, it's probably not a healthy lifestyle to live in that, at that portion of the curve.
Do you think it's worth kind of getting genetic tests to understand if you're in that, if you have a predisposition for being able to respond and adapt to endurance type of effort? Like I know, like, you can kind of see, you can look at your genetics, you can see, if you're more geared to power or to kind of short versus long. And I find that interesting.
I don't know that there's a correlation there. I'm not aware of that. And I'm not aware that the genetic testing would give you that kind of insight. That's a little outside of my wheelhouse to really be able to swim in those waters. But yeah, it would be great to be able to do that, because I would love to know if I could or not, assuming my knees would hold up to something like that. And I think it would be important information, for people to have before you embark on something like that. But I'm not sure that it exists.
So from a health span perspective, it's your take that for most folks, really long, ultra kind of endurance efforts are probably not great for the heart long term.
I would say it's unnecessary.
Yeah.
I think that the data that shows benefit is very clear, and it's typically way less time per day per workout than we ever thought it needed to be. And it's really more just the consistency piece that really moves the needle for most folks. And so I think that that's where the sweet spot is if we're looking at 65 to 70% of the population.
Perfect. I think people have a vision of the folks who end up with an unhealthy heart. They're the smokers or the drinkers. They're the folks who are eating too much or are obese. Those are independent risk factors, right, for cardiovascular disease. But then there's also folks who look really healthy. I'd love for you to talk about, what do you see in those different kind of phenotypes, and how do we think about that?
That's a really common conversation these days, I think. And I'll start it by saying, I think there's 3 misconceptions. First is that heart disease is for old people. Not true. The youngest heart operation bypass I've ever done was 28 years old. Number 2, that your cholesterol is normal, so you can't have heart disease. Not true. You can certainly have a normal lipid panel, but the kind of the next layer of that lipid panel, which there's lots of information out there about right now, particularly if you look at ApoB and lipo(a) and those kinds of things. And just not to get too far in the weeds so that people understand, this just looks at really the more pathologic portion of the cholesterol panel. So in other words, you can have normal cholesterol levels, but a high percentage of the dangerous cholesterol particles within that.
And that's the LDL-C, right?
Yeah.
Those are kind of the bad.
Yeah. And there's a group of the ApoBs that are kind of the atherogenic ones.
Right.
Some that you can control with diet and exercise, some that are genetically sourced. And then I think the third is that if I'm exercising, I'm healthy and it doesn't matter what I eat. And I think you and I both know that you can out eat any exercise that you do.
Truly.
I mean, whether it's from a caloric standpoint or from a health span standpoint as well. I mean, obviously in the lab, a calorie is a calorie because it's a heat measurement. But from a nutritional standpoint, that's not true. So I think there's that kind of basic misconception right from the start, that people kind of get down this road of convincing themselves, that I'm okay. Then there's the kind of next layer, which is this pre-diabetic layer of folks that 80% of pre-diabetics don't know. Now, I will tell you a story about myself. My son, who runs all of my social platforms and is very engaged.
He's a genius, obviously.
He's just like his mother.
Good.
He is very bright, and I give him a great deal of credit for all of our success, quite frankly. But he said to me, Dad, why don't you put on a continuous glucose monitor? And I said, Max, I don't need to do that. He said, it would be interesting. You eat right, you take great care of yourself. I was like, Max, if I need to put one on to prove to you what a great job I am doing, fine. I'll be happy.
I can't wait to hear.
Yes, I'm putting it right on the tee. I'm happy to do it. I said, it's a great idea. I think I should do it. So I put it on, and within 48 hours, I realized that things that I was eating that I thought were really dialed were not only spiking my blood glucose, which is a normal physiologic response. So people get really freaked out when they eat. It's like
that is what it's supposed to happen.
It's normal, but mine was spiking and
staying elevated. Yeah.
So my baseline to give you was 121.
Wait, you wake up in the morning with a 121?
Well, that was average. So I'd wake up in the morning, it'd be 98 or 101. Yeah.
You're pre-diabetic.
So I'm good friends with my internist who I work out with, and I started to show him my numbers. He looked at me, he's like, you have to get an A1C checked. He's like, are you kidding me? And it was 5.8. I thought that I was on the right track, but that which is not tracked cannot be improved upon. And until you know, you don't know. And so I fell into that 80% of exactly the kind of person that you asked the question about. And
if you went to a clinic, if you went to a doctor with a 98, would they say, well, come back to me when you have diabetes? Would they
you mean a 5.8?
Yeah.
So it would depend on who you saw, right? Yeah. It would depend on who you saw.
Is kind of problematic, right?
It is part of the problem. And
now you're at a point where you're like, well, okay, that's too close for comfort for you, right? But for most Americans, unfortunately, they don't get flagged as aggressively, right? And they're like, can't find.
And you know how I answer that is, first of all, think about it. The A1C is a percentage number. So what you're looking at is the percentage of hemoglobin that has glucose attached to it. Well, you're talking about 5% is normal. That's a pretty small number.
Right.
5%. Well, then the distinction between pre-diabetic and diabetic is 0.1. If you go from 5.8 to 5.9, you're then diabetic. So I would argue that is exactly the time that there needs to be intervention, because this is like an F1 race, right? I mean, like people are winning by milliseconds. It's not 2 laps. You just don't have that kind of latitude in a situation like this. So, we can all do better. We can all do better with our diet. I mean, things that I didn't realize, rice. I like rice. I don't like rice as much now.
I'll give you Marespay to reduce the resistant starch by 16%. Do you know how to do that? Oh, I'll tell you, it's been a game changer for my family.
Interest. Yeah. I mean, and it's been, since we've been following it so closely, I mean, I've been able to really dial it back so that now my average runs anywhere between 99 and 101, which isn't perfect. I'd love to get it closer down to 90. I'm going to have my A1C check next week, because I've kind of at that 3-month window, and we'll see what it is. So I think that a big part of it is being willing to have some intellectual honesty about things as well. And that's part of this piece that I think has to be included as we move into the next wave of healthcare is patient engagement. That's so critical. Now, that has to be met halfway from physicians that are refocused on patients as well, right? I mean, they have to feel like that relationship is there, because you made the comment like, that's the problem. You go in and they're like, because a lot of them don't exercise themselves and don't believe that this is the path. I think that there's some really basic things that people can do at home to kind of start, like, where am I? Just a waist to height ratio. It's really simple, because we know that adipose tissue, particularly in the midsection, is a direct risk factor for cardiovascular disease. Right. And it's really simple. You measure your waist in centimeters, your height in centimeters. It's either 0.5 or less, if you're greater than 0.5, it is an exponential increase in risk. So it's like without a single blood test,
Yeah.
check your blood pressure.
What is blood pressure and why does it matter in terms of cardiovascular health?
Super simple, just to kind of the bare bones is that blood pressure, to think about it as a risk factor, is the amount of resistance that the heart is seeing with each beat. Now, that's not the whole picture, but I think that is the way you should think about high blood pressure in particular, because that's where the risk comes from. Because as you get this kind of hypertone in your blood vessels systemically, that's what's cranking up the blood pressure. The heart is having to work harder with each beat. It's seeing more resistance. Well, the heart is a muscle, just like any other muscle. And over time, that muscle is going to become thickened and less efficient over time. And so when you have untreated high blood pressure, not to mention kidney problems, and
that's the thing. It's not just doesn't just impact your heart. The high blood pressure impacts your kidney just as much.
None of these things happen in a vacuum.
Yeah.
No, everything is interconnected. Specifically, if we're talking about cardiac involvement, that's really where it comes from, is the workload that the heart is seeing. And increased workload over time is dangerous because at some point, the heart is going to start to fail. And when we look at longevity, when we look at single elements in a workup that determine like how long is this person going to live, it's fairly simple. It's how strong is the heart pump? Patients with strong hearts do much better than patients with weak hearts. Ejection fraction, which is what measures the amount of blood that's ejected from the heart each time, is the indication of whether the heart is strong or not. Interestingly, we don't eject 100% of the blood with each heartbeat. A normal ejection fraction is somewhere between 60 and 70%, because some blood does stay in the heart with each beat. But that really is kind of the timeline that we see when we talk about untreated high blood pressure and why it's so important that it's treated early.